Good morning and good afternoon, everyone. This is Evren Ozkaya, founder and CEO of Supply Chain Wizard, and welcome to Supply Chain Wizard for Pharma podcast, where we guide manufacturing and supply chain leaders to be the wizards of change in the digital transformation era. So today I'm joined by my guest, Adrian van Hoven, the Director General of Medicines for Europe, a leading voice in the pharmaceutical industry representing manufacturers of generic, biosimilars, and value-added medicines. Adrian, welcome.
Thank you, Evren. It's great to be here with you today.
So you are joining me in Brussels, I assume, from your headquarters, and I'm in the New Jersey. So let's talk about Europe. Let's talk about medicines for Europe. Can you first maybe give us some introduction about you, your role, and medicines for Europe?
Sure, happy to do so. I'm Adrian, so I'm the Director General of Medicines for Europe. We're an association representing most of the manufacturers of off-patent medicines, so generic medicines, that's our biggest branch. Biosimilar medicines, which is something that was invented in Europe 20 years ago or so. That's our second biggest branch. And then we have a third branch where we encourage innovation on well-established molecules, things like repurposing, reformulation, this kind of thing. But today I'd like to focus a little bit more on manufacturing, which is something that's become really central to the work of our association, basically since the COVID pandemic.
Yeah, so I mean, my background touched upon in my former life in the generics as well. So I work for Sandoz, one of the largest generic companies in the world, in Europe and in the US. And what I know about generics in the US, it's about 90% of all the drugs fulfilled, right? Prescriptions fulfilled. And in Europe, it's about 70% or so, right? It's still a significant majority. What is striking about generic economics is that even though it is in the US, let's say 90% of drugs supplied, it is less than 20% of all the costs associated with drugs. So that's a super advantageous position for the patients, isn't it?
Well, it is really, really good for the patients. And in fact, in Europe, it's not just that we represent 70% of the supply, it's about 90% of the critical medicines. This is a list of medicines that are considered essential for the functioning of our public health systems. But also they really play a big role in Europe in increasing access to medicines. So they have generic medicines have doubled the access to medicines, biosimilar medicines very close to doubling the access to medicines. This is because prior to genericization or biosimilarization of the medicine, there are restrictions to the access. And so this is lifted basically due to this. So it really has a very, very positive health outcome. You mentioned the low value of generic medicines, or maybe their tremendous cost effectiveness. So that is a great point for sure for patients when they're paying or partially paying for their medicines, but also for health insurance. In Europe, it's mostly some form of public health insurance. The challenge with that, though, is that this very intense price pressure on generic medicines is also driving a lot of consolidation of the industry. So this then increases the risk of problems with availability. So 66% of the shortages of medicines in Europe are associated with highly consolidated medicines, at least for the off-patent medicines. So there is clearly a link here. I think it's very similar in the United States, actually, probably even bigger in the hospital sector in the US, but still quite similar phenomenon. And so there's really a challenge looking forward at how to make our manufacturing more resilient and more responsive. There's also a new challenge, which is that unfortunately, on the eastern borders of Europe, as you know, in Ukraine, there is a hot war going on between Russia and Ukraine, so Russian invasion. And as a result, also, Europe is now investing much, much more into its own military security. And we have been asked also by the EU and other bodies to look at what is the resilience and responsiveness of our pharmaceutical manufacturing. And one of the challenges we face is that we have this cost pressure, which doesn't really encourage a lot of resilience or responsiveness. And on the other hand, we have this very strong demand from public health and now, I guess, from national security to address this. So this is one of the challenges that we have to deal with, and I think our conversation may lead us today as well.
Yeah, so I mean, it is not by any means a simple topic. It's a complex, convoluted topic. You highlighted one very important, trade-off. Like it is cost effective, it is low cost, but is it to the point that it is damaging the healthy, survival of these companies? And seems like the consolidations point to the fact that maybe it is not healthy enough. So if it's too low of a cost, how could the generic drug manufacturers survive? So in the US side of the equation, there is this perception that the drug prices are too high, perhaps true in many of the branded situations, branded drugs, but maybe we can also argue that it is too low for the generic drugs. I mean, in some cases, my recent example of going and getting an antibiotic, I paid $0. It was so cheap, it was fully covered by the insurance, and to me, it was $0. So I don't know how manufacturers are making money, which we were going to get into. Uh, let's talk about that, let's say, effects of this to the competition. Like how competitive is generic industry, do you think, and in particularly in Europe?
Well, I think, as you know very well, Evren, the pharmaceutical industry, it doesn't matter if it's the innovative pharmaceutical industry, the generic pharmaceutical industry, the biosimilar pharmaceutical industry, you need to continuously invest in manufacturing, even just for compliance. So I know we've looked at some data that for the investment in some manufacturing plants in Europe, exclusively for the compliance with things like GMP, or sometimes we have also very strict environmental regulations, as you know, in Europe, environmental regulations. So just pure compliance, this can be 70% of the CapEx investment into manufacturing here. So just to keep a factory running and compliant with good quality, et cetera, you're investing. Now, if we think that we need to go further and invest in security, responsiveness, et cetera, you of course have to invest more. And then, as we know, there's also a growth in demand for medicines, right? Because unfortunately, disease rates are mostly rising. Whether it's chronic diseases or acute diseases, we're not seeing this kind of dramatic decline. That's very good because we can make the medicines accessible and treat people and therefore keep them healthy, which is, I think, the most important thing. So what you have all these demands on manufacturing, and I do think there is a problem in the European market, at least, that we have a system that is not rewarding or incentivizing investment into manufacturing. So that's not, that's about how to expand the production capacity, but also how to make it more responsive because you have surges in demand, you have certain risks that you need to take account of. And I think this is where we need to go. And there's actually a new law being proposed, the European Union, called the Critical Medicines Act, which aims to introduce basically security of supply criteria into European pharmaceutical markets, at least for this list of critical medicines, which is mostly generic medicines.
Okay, so that's very interesting. So this is a very striking, analysis. Actually, the 70% of the capital investment is just to keep the lights on, the bare minimum compliance, which leaves very little for productivity, for digitalization, for security, for resilience, which they're so big of topics that should not be the minority of the investment. They should get at least a fair share. So how do you think this affects the competitiveness of European manufacturers? Do you think in the world stage between United States, India, China, Latin America, how does European manufacturers stack?
Well, I think it's very, very clear that in Europe, we still have competitive manufacturing, but we are losing our edge to Asian countries, principally China and India, who are formidable competitors, but are also, I'm sure, investing significantly more in the growth side of their industry than we are. So in some ways, you can probably say that the European industry is still growing, but it's not capitalizing on all the growth opportunity, like, say, the Indian industry is certainly doing. So
Hmm.
we have to do something now to strengthen our competitive position. Um, Clearly, in Europe, we have certain costs that are higher and are likely to remain higher. So we're going to have higher labor costs,
Hmm.
probably less labor flexibility, and I'm I'm absolutely certain we have higher environmental compliance costs as well. So we have all this cost base that's higher. So we have to think, how can we invest in a very, very smart way in more modern technologies, be that chemistry or biotechnology or digitalization, to make our industry more competitive, to close that gap. And I consider really India to be the benchmark for us because, I mean, they're super competitive. I respect, how great that industry is, and we need to see where they're going and try and match them or even go beyond them.
Hmm. Well, maybe to put things into perspective, well, there are differences between regions and different regional players. I would say as a long-term consultant in the industry as well as a technology provider, the digitalization or maturity of the industry is still very, very low. Like not even 10% of the factories. Actually, in one of my podcasts with Microsoft experts, we talked about this number being less than 3% of pharma factories to be truly digital or on the way to be digital, which means that most of the industry players are still on paper, on spreadsheets, on manual ways of working. So we haven't really pushed the industry towards that higher level of digitalization. So that is actually an opportunity. So we might be falling behind in Europe, but it doesn't mean the game is over. It's like just starting. I think we see the increased amount of investment and focus, but it's about time. So switching gears to find the solutions to this problem for Europe, what do you think the role of the government or in general the European Commission should be in addressing this European productivity gap?
Well, I think certainly the European Union, and in this, I mentioned this Critical Medicines Act, which is this kind of industrial policy law. Um, I think really we should look at devoting some funding to the digitalization of the manufacturing side of the business. I think there's a growing use of digitalization in the development R&D side, and that's a good thing. And we can see it's bringing a lot of productivity gains and improvements there. But I think there's still a lot to be done on the manufacturing side, as you said. Even, of course, there are computers and there are digital things in the factories, but a lot of it is using, older documentation, which is essentially a paper version of digital, right, inside the computer. So we need to move
Hmm.
towards a truly digitalized approach, and this can have many benefits. It can help us address this competitiveness gap that we have, which is growing with certain Asian countries, particularly India, but also to a certain extent China, and help us, put ourselves on a more competitive footing. It can also help us in Europe because I think we have an advantage of having highly skilled and well-trained and well-educated labor, but we have a shortage of it.
Hmm.
So by using that skilled labor and attracting them in with digital opportunities, maybe I can put it like this, but inside our production sites, they'll be doing a lot of digital, very modern, very highly educated work, which is what many of them are trained to do or can be quickly trained to do. But as we don't have enough of them, essentially in most European countries, we have a shortage of the skilled and unskilled labor. We can address also this challenge because we're not going to invent people out of thin air, but working with digital tools, it's more attractive to come work for our industry, but also it addresses this shortage, what is essentially the case, I think.
Well, every country in the world is growing old, in most countries at least, right? Europe definitely is one of those regions where the population is getting older, which drives higher need for healthcare, People live longer, which means they are more longer sustaining these chronic diseases. There are medicines for it. The innovation is there, but which create the factor that create this growing demand is also creating the shortage of labor who is able to work on that. And therefore, we need to do more with less. We need to do more in every factory with less people. Doesn't mean we are reducing people. It means we have a growing demand, right? So I think that's a very good point. The labor aspect of it, sure, it's costly, but if we can find ways to eliminate most of the manual work, we can use the existing skilled labor to produce more at a lower cost and gain that competitiveness. One
Yeah.
statistics we heard recently in the research of big consulting firms is use of AI and technologies, advanced technologies can literally double the EBITDA of companies, right? And majority of this doubling effect comes from manufacturing and supply chain. There's actually a PricewaterhouseCoopers analysis out there talking about EBITDA going from 20 percentage points to 40, and significant majority comes from manufacturing and supply chain. So it's an untapped potential. Unfortunately, we need to address that. Otherwise, it is hard to tap into this potential. So, any incentives or any ongoing things that you can mention from the European Commission or the roles of individual countries that is already out there that we should do more of?
Yeah, so definitely, I think just to add to your point, I think we also have to remain an attractive industry for people to come work with us. I think it's still a nice industry to work for, a relatively high-paying industry, et cetera, but still the attractiveness of the work, I think, is what's motivating a lot of people today. And that's why this digitalization can also make it a very exciting prospect for young and more experienced people to come work with our industry if we move in this digital agenda. But coming to the EU, I think one of the challenges we are facing with the EU is that they don't consider generic manufacturing, generic medicine manufacturing as a form of innovation. They say, well, these are molecules that are 20, sometimes 30, sometimes 40 years old. Where's the innovation in that? Well, this innovation is super, super important for Europe's security of supply and to address, the growing healthcare needs to keep our population healthy. Even, we still have pockets in Europe of very low health outcomes. Most of Western Europe have very positive, high health outcomes, but in some Central and Eastern European countries, for example, you still have relatively low. And this is mainly due to the need for better access to medicines. So I think we can achieve these objectives, but we need to recognize that, for example, investing in digitalization in our production is a form of innovation. And if we can change this in the law, then that means we can have access to EU funds to support the industry on this transformation. And this is totally justified from a public perspective for two reasons. One, I think we can improve this efficiency, competitiveness, et cetera. Also, we can reduce a lot of waste, which is very important from an environmental perspective. As you know, in Europe, this is a very, very important point. And the last point, so actually it's three issues, is we have these kind of security demands for a potential health crisis like a new pandemic or some kind of natural disaster, or helping countries around Europe that have a natural disaster, like you recall the big earthquake in Turkey. Well, of course, then as Turkey would help us in an earthquake, we have to help Turkey in an earthquake, and this was done. Or in the very unfortunate situation where Europe would be at war, which a few years ago I would have said this is not going to happen. Unfortunately, today it is a risk. And so for this, we need an industry that can respond very quickly and very efficiently to huge demand surges. Because a lot of governments in Europe and the EU, they say, oh, we need a stockpile of this, that, or the other thing, which is fine. But for any major health crisis linked to a natural disaster, a pandemic, a war, you have a demand surge over a couple of months, which is about 10 times the annual demand of the product. And we've done these different scenarios for different kind of risks. And this is what you come to. 3 times the annual demand, 5 times the annual demand. During COVID, we had 10 times the annual demand, okay, for certain medicines.
Yeah.
And so you can't stockpile 10 times the annual demand. It's the most wasteful thing you can do. You wouldn't even have enough warehouses in Europe to do this.
Or it would have a lot of expirations and such a loss of that product that is not going to be used in most cases. Just
Yeah,
for a small chance of this, risk items, you have 10 times the inventory will be going to waste.
exactly. But what you can do is contract with the industry to hold inventories of, let's say, inputs that have a longer shelf life, to adapt, and this is where I think this digitalization could come in, to adapt the functioning of the factory to be able to suddenly produce for a surge. And as you know, this is very, very complex from a quality point of view. It's very complex from a human resource point of view. It's very complex from a regulatory point of view. And I believe that with digitalization and the experience we've had with crises like the Russian invasion of Ukraine or the COVID pandemic, where we had to respond to massive surges, we could put this in place, and with digital tools, we could be so much more efficient. I mean, dramatically more efficient. Um, and just coming back to that skilled labor point, uh, we cannot hire 10 times the amount of labor overnight for 10 times the need. We have to do this in a very efficient way. Of course, you can add a line or run the factory 24 hours a day, which means you do need to hire people. This is, of course, necessary. But you cannot, dramatically increase. This is just not possible in a pharmaceutical industry where the labor is so skilled and so technically trained. So digitalization here could play a very fundamental role.
Yeah, so actually, I can give you another case study example from the pandemic. We did cover one of our conferences, the case of Tylenol from Johnson and Johnson, which is now Kenvue, the OTC over-the-counter drug, Tylenol. And we have, with my former boss from Sandoz, who is now at Kenvue, we wrote an article which was published in Harvard Business Review, and it is called "How Kenvue De-risk Its Supply Chain?" And it's exactly for this point, like the Tylenol demand surged 12 times, not 10, 12 times during the first couple of months of the pandemic. And then, funny enough, it sustained the full demand at a 3 times the annual level. So the supply chain that is built for 1x now needs to work at a 3x capacity. You cannot 3x the number of hours in the day. You cannot 3x the factories overnight. So they need to find every single possibility. So there are cases of learnings that we can draw from. But I think you're right, inventory will not solve this. Capacity may solve it, but digitalization will allow the better use of capacity, not at the factory level, but also company level. But if it is a European Union driven initiative, perhaps across companies, country level response to these pandemic like or war like events, where everyone can better coordinate. They know their capacities, their utilizations, which site runs better. We can collaborate on that as well in a case of crisis. So these are all valid points. So what should we do, right? What should we do to get there? What should we do in terms of, bringing the support that is needed to push the manufacturers towards a digital world? I mean, Medicines for Europe and Supply Chain Wizard, we have been collaborating for now 10 years on, serialization, FMD regulation in Europe. But I think there's a new challenge ahead of us, which is how do we collaborate to get the industry moving fast on the digital transformation? So maybe you can talk about some joint initiatives or ideas that we have to bring momentum to the industry.
No, absolutely, and I think that example that you gave of Tylenol is absolutely spot on. I think the challenge with crises, right? You don't know exactly which medicines. You can come up with scenarios and determine the medicines, but still, this is going to be a quite a range of different medicines. Like the critical medicines list in Europe is close to 300 molecules. Okay, so you need to look at this as an industry-wide collaboration. in a pro-competitive sense, of course. So what I think for Europe, at least, what we should do is with this critical medicines law, we are basically advocating for a kind of EU fund to enable the industry to invest. And some of this will be around, more modern chemistry processes or biotechnology processes, et cetera, which are also super important, but also this digitalization, because we have to square this circle with the shortage of skilled labor and sometimes the unattractiveness of working in a more traditional factory setting, to bring it more modern and up to date. We have to deal with these constraints and risks that are, of the type you mentioned, where you go from producing 1x to having to produce 3x for a substantial amount of time, right? And you're stretching your capabilities and your resources to the maximum during those points,
Mm-hmm.
right? I mean, you probably remember during COVID, first wave of COVID, I was working 7 days a week. I'm the head of the trade association. Okay.
Mm-hmm.
And so imagine in our factories, it was working, like crazy. Also, funny point, during COVID, the absentee rates in our industry were lower than during the pre-COVID times, in spite of the fact that some people were getting COVID and obviously were not allowed to go work in the industry at that time. So this is,
Mm-hmm.
showing also how motivation is probably the main driver of people being satisfied at work and things like this, because people were just motivated to do the right thing and supply medicines, et cetera, et cetera. But I think this digitalization is really a key point. And we are really struggling in our industry. So we're dealing a lot also with the regulation, the digitalization of the regulatory requirements, of the supply chain requirements. And I think we need to bring this discussion also to the factory settings so that we can address this. And I think digitalization will be a real opportunity. So I think there are two things. We need to engage with the companies to create the awareness that there are solutions out there. There are systems that can be invested in, because this is going to be driven mainly by private sector investment. And we need to work with the European Union, the politicians and in the Parliament and in the European Commission and the Council, et cetera, to convince them that this is something also worthy of supporting or incentivizing in Europe, because it will address so many of the needs: access to medicine, security of supply, crisis response, and competitiveness. So maintaining a strong and robust pharmaceutical manufacturing sector in Europe. If we don't invest in this kind of thing, and invest intelligently, doing smart investment, you can forget about Europe being a competitive platform for pharmaceutical manufacturing.
Yeah, no, these are great points. So, I mean, there is a very limited number of levers to pull, and digitalization lever is such a lever which it hits all the right notes, right? It contributes positively in all the objectives: crisis prevention or response, the productivity gap, growing demand, satisfied workforce. Like it hits all these things at the same time, but it needs to be a smart investment, like you said. It cannot be, you invest and digitize everything all at once. It needs to be carefully planned. It needs to be done right, etc. And one thing that I want to highlight, what might seem like a disadvantage for Europe, high cost of labor, shortage of labor, can actually turn out to be one of its biggest advantages, because let me tell you, in digital transformation, people and adoption is the number one success factor. Not the technology. Technology can be made available anywhere in the world with the cloud infrastructure now in place. The processes are more or less established, or the best practices of lean processes are there. But people makes all the difference in a digital transformation success. And Europe has abundance of skilled people who can adapt faster and use the technology better as an advantage. So I just want to highlight that. So maybe a talking point in the European Commission, or when we are discussing about getting incentives. The
Yeah.
other resources,
Yeah.
yeah, go ahead.
No, I was just going to respond. I think you're spot on there, Evren. I think one of the challenges, with this discussion on digitalization and artificial intelligence and all of these things, I think everybody recognizes that we need to go down this path. I think that the difficulty, and this is where hopefully our collaboration can bring some support here, is to say, okay, and so how do you do this in a pharmaceutical manufacturing setting, right? This is the key, I think, so that essentially the decision makers in the companies in charge of the manufacturing see where they should go, how they should go, and what are the the returns that they're going to get on this. I think this is the key, because you you probably I get every week an invitation for some discussion on artificial intelligence, and most of the time it's not tailored to what matters for us. And I think this is really the key to getting an adoption and a positive spirit going.
Absolutely. Because you mentioned the AI, and we are over flooded with these companies, startups, ideas, webinars, which is important to highlight, like how AI works, how these advanced technologies work. It works only when we have data, and good quality data. Pharma does not have data or good quality data of its operations, not talking about compliance topic. Of course, we have a lot of
Yeah.
data on paper with GMP compliance, making sure that the drugs are made the right way, it's complying with all regulations. I'm not talking about that. I'm talking about operational data is either non-existent or on paper or spreadsheets. AI cannot operate in this environment. So we need to fix the fundamentals first, build the house from the foundation up, and AI is the roof, right? AI, we don't start building from the roof, we start building from the foundation, and the foundation is data. And a lot of pharma companies struggle to understand that. Everybody likes to see, oh, I want to use AI. Can we use ChatGPT? Can we use LLM models? Sure. But then there's a saying in industrial engineering for simulation models: garbage in, garbage out. Your AI models cannot process garbage or lack of data. So that's a very important thing. And I want to highlight maybe one resource, and move into the maybe the recommendation, the last messages part of our podcast. There are resources. We during the pandemic, actually, we as Supply Chain Wizard collaborated with INSEAD, one of the leading business schools in Europe, probably the top 5 or top 3, and with the professors at INSEAD, we collaborated in creating a digital factory, simulation model based out of our work in pharmaceuticals, and we evolved that simulation to be an executive education workshop. Which now, I was in Paris last week in the Viva Tech conference, which is the largest tech conference in Europe, and we reconnected with the professors at INSEAD. It turns out that the collaboration that we did during the pandemic times turned into a great core curriculum as part of the MBA and executive MBA classes. So they're actually using pharma as a case study to teach digital transformation, to teach how not to do digital transformation or how to do digital transformation. So there are now resources, the training resources, the educational resources. So I'm just plugging here a little advertisement for INSEAD, because it's a European institution of very well respected, and companies can utilize these resources to learn more about how it is done, and then go ahead and do it in a way that can bring short-term competitiveness, productivity, which can fuel its own future rollout of these technologies. So it's not something that we are looking for investments, right? For the sake of, okay, well, you need to invest millions. Let's see if you're going to see the return. These digitalization investments are actually relatively small and can show return within the same year, which can then fuel the rest of your transformation. So I think the starter investment or that incentive is needed, but once the starter is in place, the rest would be self-fueling, self-driving. That's like the biggest, I think, financial message that I want to give for Europe. And I think your role is, Adrian, very critical, because you are in the intersection of the industry, all the generic and biosimilar manufacturers and the politicians and the country heads. How can we get that initial momentum in place so that we can fast track the innovation in the manufacturing sector?
No, I couldn't agree more. I think we need to recognize that this will be an incremental process in some ways. and also, we need to make sure that the industry is comfortable, because there is this whole regulatory control oversight side, which needs to be carefully managed, of course, in this process. But I think this way, as you say, you can move forward step by step, and then, with each step, you're improving that productivity, you're improving that responsiveness, you're addressing those constraints, labor or other resource constraints that you are in reality facing in Europe. And you can step by step bring the industry down that path to success. And once you have a few small successes, you can step it up and go further. But I think this discussion around this industrial policy called the Critical Medicines Act is a good way to start moving from some of the blah 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 we hear sometimes in these discussions in Brussels to something more concrete of delivering. Because un- unfortunately, I know the next crisis, I'm going to be getting the calls saying, okay, we need to mobilize the industry, we need to do this, we need to do that. And if, as you say, we're just working with a bunch of Excels and trying to piece everything together, it will be extremely cumbersome and extremely messy. If we start moving forward in this basis, first, we'll be already more responsive, and second, we'll be able to cooperate with the authorities to help them, in a much, much more efficient way. So I think this is definitely the way forward.
Excellent. So let's wrap up with some messages towards different audiences. Like, for example, what would you say in short, in this whole context of like competitiveness and digitalization? First of all, to generic companies, and then what will be your message to generic companies, and then maybe to branded companies, and then to European Union and European Commission. So maybe like in those three orders: generic, branded, and the European Commission.
Sure. So for the generic industry, for my own industry, I mean, I think everybody knows I've really worked over the years to strengthen the competitiveness of our manufacturing footprint as part of our role in supplying 70% of the prescription medicine. So I consider that essential, that security side of things. That security dimension has grown over time into other issues, crises, pandemic, et cetera, et cetera. And now, we need to invest in the competitiveness of our industry so that we remain sustainable and financially attractive, et cetera, et cetera. But we also have a public obligation to do this. And I think we know the constraints, all the CEOs of the companies, they know the constraints. So we need to use technology, digital technology among them, to help us move forward in this direction. It's definitely a part of our program, and so we need to work together. That's what I'd say for the generic industry. I'd say for the innovative industry, I don't think it's any different, because in the end, the manufacturing is not very different between the two sides. So they have similar challenges. I think actually many of the innovators even struggle more with responsiveness than the generic industry, just because of the way their processes are in place, and they're used to more mono production than the generic industry, which is more flexible, moving things around and stuff like that. So I think this can also be very important for our colleagues on the innovative side, who also have a big role to play, vaccines production and all this kind of stuff, as you know, super important. Then for the European Union, what I would like to say is, I think we are in agreement with most of the politicians that we need to invest in very resilient, very responsive pharmaceutical manufacturing in Europe. Doesn't matter, generic, innovative, etc. We know we have major constraints, and we need to move away from talking about it to doing something about it. And I think some kind of big European project to incentivize digitalization of our production will bring a big chunk of the response. Not everything. Well, there needs to be a lot more there. And this is where the European Union can really help incentivize this kind of transformation. And it will be good for Europe's competitiveness, good for security of supply, and good for access to medicines. So let's start talking and start doing.
Perfect. No, it's a great message for all three segments or the players in the market, and for European Union, and like to bring the players together. I think our idea of like potentially organizing a focused conference in Europe, in Brussels, bringing the players together, maybe the generic industry, the European Commission, as well as the technology providers, to show what is out there, what is possible, what is the ROI, and then let that conversation evolve into action, right? Not more conversation, but into pilot projects, into testing and trying and seeing the results, and maybe bringing from other regions of the world. And I can give you, and I travel a lot, as you know. I was in Saudi Arabia a couple of weeks ago with one of our customers. There's a massive construction going on everywhere. They're building factories. Why? Because they are putting in place rules that only will, refund manufacturers if it is made in Saudi Arabia. Similar rules are in place in Turkey. The similar rules are in place in Brazil. So all these manufacturers are going there because there's no refund, rebate otherwise. So, what should we do in Europe so that we can incentivize the same way, so we can have more local production? I think that needs to be happening soon. And maybe my final signature question at the end of each of my episodes, I always ask, because part of our mission is to educate the young professionals or students who are looking into this industry and want to come to pharma. And we don't want to discourage them by talking about all the challenges. We want to encourage them to come in. So what would be your message now, looking back at your career, there's a good number of years in pharma, for a young professional looking to get into supply chain or manufacturing or any core function in pharma? What would be your message?
Yeah, I mean, I think my message to young people is that this is an exciting sector to be in. It's not easy. There are a lot of challenges, and you have to really be quick on your feet to solve them. Like we're discussing now, we need to address this competitiveness issue for our manufacturing, this responsiveness issue for our manufacturing. But there's always a solution, and you can help contribute to finding it. And I think what's truly motivating for people in our industry, in my belief, and that's why I talked about those COVID times and those very low absentee rates, is that, in the end, you're helping people stay healthy and live longer. And one day or the other, everybody's going to need medicine. And you're, by participating in the work of this industry, you're playing a role in that. And sometimes it's hard to see. You don't see that patient at the end, of course, but during any crisis, during any major event, you feel it immediately, and you feel the tremendous weight of the responsibility. And I believe that most people are motivated by that high degree of responsibility, and that's why it's
Mm-hmm.
still a very attractive place to work, even if there's a lot of work to do. I'm not going to hide that.
Mm-hmm. Yeah, no, absolutely. No, this is great. It matters. It saves lives. It makes people live longer and healthier. It's a growing industry. It's a recession-proof industry, and we have so much work to do, which means so many opportunities for the young
Exactly.
professionals. So it could be a nice, long, and fulfilling career, and that's why we need to attract more of them to come in and change the industry, change the way we work. But this conversation was, one of the best. Lots of great messages to the industry, lots of great messages to, the government side of things, and definitely a great message on digitalization and why it is useful. Looking forward to our collaboration and getting this voice out there and turning it into action. Adrian, thank you very much for joining us for today.
Thanks a lot, Evren. It was great to be with you, and looking forward to a second collaboration in the future.
Okay.